Welcome to Voices of Health Justice, the official podcast of Advocates for Justice in Education, or AJE, in Washington, D.C. I am your host, Amilka Hudson, the parent organizer at Advocates for Justice in Education, and I'm joined today by my team members of the Health Justice Project at AJE, Chioma and Danny.
Hi, I'm Chioma Oru. I'm the Health Justice Project Director at Advocates for Justice in Education.
Hi, everyone. My name is Daniela Gonzalez Rios. I'm the Health Justice Coordinator at AJE.
So AJE's mission is simple but profound: to educate, advocate, and organize alongside families raising children and youth with disabilities and special healthcare needs. We believe that narrative, that our stories, our struggles, and our collective dreams are critical tools for organizing and building systems of care that honor dignity and disability justice. And so, with no further ado, I want to pass it off to Danny to take us into our first episode.
Thank you, Emil. So this first episode launches a conversation we hope to continue unpacking throughout this podcast series. What is the future of caregiving in the current political climate, locally here in DC and nationally? There's no neutral movement, and this era of the One Big Beautiful Bill, or HR 1, is no exception. Families are navigating Medicaid changes, new challenges in care coordination, and food insecurity, and federal uncertainty about the future of health justice and disability rights. Our first guest joins us at the exactly right time to help us make sense of one of the most consequential developments in DC Medicaid history. We are honored to welcome Zenia Sanchez-Fuentes, Esquire, a leading attorney and expert on Medicaid, EPSDT, and civil rights enforcement. Zenia has been deeply involved in the decades-long Salazar versus District of Columbia litigation and the recent settlement agreement that is reshaping how DC must meet its obligations to children and youth with disabilities. Zenia, thank you for joining us. I'll pass it to Chioma.
Thank you, Zenia. For listeners and viewers who are new to the history of the Salazar case or may not know what EPSDT is, can you please explain what the case is and how it shaped DC's Medicaid system and why this settlement is so significant?
Absolutely, yes. So the Salazar case was a class action lawsuit that our law firm Terrace Pradlick and Millian brought on behalf of a large class of Medicaid beneficiaries to vindicate their rights under the Medicaid statute. And that was way back many years ago. And that resulted in a court order in 1999. And at the time, there were various different kinds of groups that different subclasses that we were helping. Many of them were individuals who had Medicaid, but whose Medicaid benefits had been terminated without any prior notice. And so that was one group. We had another group of individuals who had submitted payments, who had paid out of pocket for Medicaid benefits that DC Medicaid should have paid for. We had, and the most important group, and as it relates to the topic today, I think we had represented all of the children eligible under the District of Columbia's Medicaid program from 0 up to age 21, whose services were being denied, terminated, or suspended. And those services are services that children get under the Medicaid statute that are referred to as the early and periodic screening, diagnostic, and treatment services, which is a very robust package of benefits that the federal government provides and that states work with to provide. And so in 1999, we entered into a court order following a trial in which the court found that the district had violated a lot of the beneficiaries' rights under Medicaid law. And as a result of that court order, the District of Columbia has to meet various provisions and various requirements in that court order, a lot of them having to do with, for instance, making sure that they provide well child visits to every child, as the periodicity schedule in the District of Columbia provides. They're supposed to provide care coordination. They're supposed to provide transportation. They are supposed to provide reports, regular reports about how often they are providing some of these services. They're supposed to track the provision of these services and provide reports about that as well. So all of those have been sort of key portions of the consent decree that my law firm has been monitoring for well over more than, I guess, 2 decades now. And throughout that time period, the district has made a few, many positive improvements. For instance, they have, under Salazar, there was an order entered by the court that allows individuals to seek reimbursement for out-of-pocket expenses. There have been changes within the EPSDT program that have allowed, for instance, for better tracking, and lots of individual help has also been provided to individuals. So as a result of Salazar, we have been able to represent individual children whose Medicaid benefits have been terminated or suspended. We've also been able to help them when their eligibility has been cut without prior notice. And so we've been able to help many individuals at no cost to them through this case. And so it's been about a couple of decades now. And so we think it's been very significant. But recently, after those 2 decades, there have been settlement discussions with the District of Columbia, who is the defendant in the case. And we have agreed that that the consent decree will end, and that there will be a period of time, approximately 2 years, during which the District of Columbia has committed to take several actions to make sure that there is a durable remedy to the violations that they've committed previously. And that is the settlement agreement, Chioma, that you were just talking about.
Okay, so one of the areas that families ask us about constantly in the EPSDT mandate, in terms of what their children are entitled to and why they struggle, how does the settlement agreement strengthen EPSDT enforcement, and how what specificities in that has allowed you to support? And just full disclosure, I'm one of the benefiting families who has been a huge benefactor of Zenia's constant engagement with the system actors. But just for the benefit of everyone that may not be familiar, what are the specifics of the agreement moving forward? And, I guess in the past too, like what has it looked like, and then what could it look like potentially moving forward?
Sure, yeah. So let me talk a little bit about the future and the settlement agreement. So the settlement agreement was actually entered, or was executed by the parties on October 31st, 2025, this year on Halloween. And so it's effective on that date. However, what it means by that is that the 12 months start running for the district to comply. It hasn't been yet entered by the court, and so we're still waiting for the court to enter that, after which there will be a fairness hearing set. Well, all the class members will receive a written notice, and then there will be a fairness hearing held at which class members can opine and about the settlement agreement. And then the court, we expect, will enter the settlement agreement, and it will have sort of the seal of the court. But the settlement agreement is something that we really recommend to the class, because we think it provides substantial benefits to the class. And some of the key provisions are, for example, I was mentioning before, the reimbursement provisions that are currently something that the court, something that beneficiaries have access to as a result of a court order. However, what the district has agreed to do now is to actually make it into a regulation, a District of Columbia regulation, which is more solid. And so what this will do is it will take all of the prior requirements that are in the federal order, and it will make them into the regulation so that beneficiaries who, for instance, have to pay out of pocket for, I don't know, prescription drugs, or when they go to the doctor and somehow the doctor realize they're not eligible, but they should have been eligible, or for instance, they had to pay because the managed care plan didn't provide those services because they didn't have those services. All of those circumstances, they could potentially seek reimbursement from either the managed care plan or from the District of Columbia. And then within 60 days, the managed care plan or the district should make a decision and reimburse that individual. And so what the district agreed to do is put it in a regulation, but also extend the time from 6 months to 1 year from which a Medicaid beneficiary can seek that reimbursement. So right now it's, within 6 months of when that person incurred the expense, but that is going to be within 1 year based on the regulation. And the regulation was promulgated by the district also on October 31st. A lot of things happened, and it is not final yet. It is in draft stage, and we can come back and talk a little bit more about that, but I want to go through the rest of the settlement agreement. Because I think the other portion of the settlement agreement that I think is really important is the transparency and accountability portion of it. So what the district has agreed to do is to create a child health focused report card that will be published online, and it will include a bunch of metrics on child health measures, preventive and treatment, chronic illnesses, things like that. And it will compare how managed care plans are doing against each other. And also it will have a link that will send you to a dashboard that will then compare how the managed care plans are doing compared to the national standards. And so we think that's going to be something that's going to be helpful for parents. And there's also going to be an online dashboard that the district will be creating over a period. There will be 2 phases that is going to show how the managed care plans are doing in providing a range of services to children and adolescents. The other provision which we think is going to be really helpful is the child health focused subcommittee that will be created within the Medical Care Advisory Committee that currently takes place. I think it's every 2 months, and that committee is a committee that meets by statute. It's the managed care plans, it's providers, it's beneficiaries, and it's the Department of Healthcare Finance, which is the Medicaid agency. So they get together and talk about issues that have to do with Medicaid, any new state plan amendments, anything that's happening that is of relevance. And so what the district has agreed to do is to create just a committee that's just focused on child health subcommittee issues, child health issues, where Medicaid families of children can participate, and they can meet regularly with DC Medicaid staff and leadership throughout the year. And there will be a stipend of $75 per meeting available for caregivers to participate. And that committee is supposed to be a place where families can come and both provide feedback to the district about how things are going, and also get feedback from the district. So it's supposed to be sort of this loop where the District of Columbia can understand what the issues are and try to incorporate those in its plans and in its measurements. The other provision that I think we're also looking forward to being enacted is the advisory expert provision. So there are currently about $700,000 in an escrow fund, in a penalty escrow fund that is held by the court for the benefit of the plaintiff class, which currently is, like I said earlier, about 100,000 children in the District of Columbia who are eligible for Medicaid. So that portion, a portion of that escrow fund is going to be used to hire 2 advisory experts to assist the district in better serving this community. And these experts are nationally renowned experts who have a lot of experience and whom we have a lot of confidence in and we trust. And they will be kind of looking at over a 12-month period, lots of issues like issues affecting the special needs population, issues affecting, the quality of care, issues affecting shortages in workforce, all those sorts of things. And they will be recommending effective improvements. They'll be meeting with people in the community as well. There's focus groups. And so we're very excited about that. There's also going to be a study that will be funded also by the escrow funds that is going to look at the shortage of personal care aides in the district and look at how the district can implement participant-directed services so that caregivers and others can be paid to care for our children who right now, as we all know, there's a huge shortage of qualified personal care aides. It will be something like Services My Way that currently exists, but for this group of individuals. And finally, there are going to be organizational grants that will also be funded by the remainder of the escrow funds that will be used as grants to sort of address many of the unmet needs in the District of Columbia for children and adolescents. It'll address, staff shortages, educating and empowering caregivers, and other purposes. So we are very much looking forward to those provisions being enacted. Like I said, there are different timeframes for when those things are going to be happening, but those are the things that we think are going to be really advantageous for the plaintiff class.
Thank you so much. That's so much. I mean, it's bittersweet, right? That it's ending, and can you just help clarify what is the main difference between what you were doing in terms of supporting the process before, I guess October, Halloween this year, and what's the main difference between before and after? Would you say?
Sure. Yes. So some differences. So currently, and I will say because we're currently still under the consent decree because the court hasn't vacated it yet. So under the current consent decree, the district still has an obligation to meet a 75% participant ratio, what that means is the district has, and that was the main exit criteria for the district, which they have just not been able to meet over any kind of extended period of time. And what that is a requirement that the district provide well child visits to 70% of the children in the district. And if they had been able to meet that criteria many years ago and other provisions in the settlement, in the consent decree, they would have been able to exit it, but they haven't. They just didn't meet those. So currently, under the consent decree, the district has to create corrective action plans that it develops or the managed care plans are supposed to, when they don't meet when they don't provide well child visits to 80% of their enrollees, they have to create, or below that, they then have to create corrective action plans that identify actions they will take to improve the delivery of well child visits. And it also sometimes includes the delivery of dental services and bloodlet tests, because that's something else that was achieved under this consent decree. And these are created every year when they don't meet the cap, which they haven't met. I mean, when they don't meet the numbers, which they haven't met. And then the managed care plans are also sanctioned. So they are sanctioned for each child above the number that they're not able to meet. And so those are financial sanctions that are going to go away. That's one of the main differences, that those sanctions will go away. But in place of that, there will be a lot more transparency. There will be this dashboard where anybody can go and see how are these managed care plans doing, and then if they can, parents can complain about it, could talk to the managed care plans, or talk to the District of Columbia for example, at the MCAC meeting. And so there are venues established for caregivers to provide feedback based on the increased reporting that we hope takes place about how the managed care plans are doing, and in place of the corrective action plans, there will be these experts who are going to take a very deep dive look at what's happening in the District of Columbia with the provision of these services and sort of make recommendations that the district will consider in good faith and hopefully implement in the future. I think the main difference for individuals, which is unfortunate because we've had the privilege to help so many, is that we will no longer, once the court vacates the consent decree, which hasn't happened yet, we will no longer, our firm will be able to represent individuals who are having issues obtaining these Medicaid services to which they are entitled. And that won't happen. On the other hand, we hope that these organizations that will receive funding will be able to provide help to these parents so that they can empower themselves, understand what their rights are, and be able to assist and be able to sort of help themselves gain access to these services.
Thank you. I have one more question and then pass it
Sure.
on to Danny, which is, so the settlement, I believe it lays out new roles for the Office of the Ombudsman, Health Ombudsman, and the MCOs and DHCL itself, Department of Healthcare Finance itself. Can you talk us through what meaningful accountability should look like beyond the MCAC body, which is just advisory, not regulatory, and where families can intervene if something goes wrong? Would you recommend?
Some accountability didn't discuss earlier, but for instance, there is a provision in the settlement agreement that requires oversight, that the District of Columbia provide oversight of timely access to and availability of the managed care plans provider network. So as part of the agreement, the managed care plans are going to be required to conduct internal managed care plan access and availability audits to validate access to individual providers within their networks. And so that's going to be sort of beginning within 6 months of, 6 months from October 31st. The district will be collecting and monitoring the results of those audits that are specific to children's access to providers and appointments, I think on a semi-annual basis, to ensure compliance with, the district's appointment weight standards. And so as part of that agreement, the results are going to be publicly available. Will be publicly available. Well, they won't be publicly available made by the district, but they will be available through a district, the FOIA process, and or included as a metric in the child health focused annual report card. So I think a lot of it is kind of happening behind the scenes, but then the results are going to be transparent and accountable. The district, through its external quality review organization, they conduct and publish results of surveys that measure, the managed care plan compliance with, for example, timeliness standards for routine pediatric appointments. And in 2024, the standards were, I think it was the 4 managed care plans received a score, I think it was over 92% for timely access to pediatric routine appointments. But the district is going to now require that any managed care plan that falls below 90% compliance with access to pediatric routine appointments with that measure, that it will develop and implement a corrective action plan. So those are sort of corrective action plans that will be that are going to be things that can be shared with the public during the MCAC meetings. And I think one of the primary, venues of information sharing is going to be the MCAC and the dashboard, which is going to have a lot of information there. So we see that as a really strong venue.
So just for clarification and just, in my own mind, having gone through some of the grievance processes in the past, is there any new direction or guidance that makes that a more effective on the day-to-day? Like if a small issue happens and a family has an issue, before it gets how does it get to the dashboard in the NCO's obligation to report? I mean, I hope I'm being clear in terms of like what are the steps a family would take on a daily incident that would even put it on the radar for the dashboard.
Yeah, so the families have the opportunities to provide, to file a grievance if they have a complaint or if they have an issue with the quality of the care that's being provided to their children. They also have an opportunity to to appeal a decision and to take it to a fair hearing. And we're hoping that some of that load will be taken up by some of the local agents, some of the local organizations in the district. There's legal services. There are other organizations, disability rights, who can help, we think, with the sort of the heavier lift of perhaps appeals or fair hearings. But there will also, in terms of grievances, that's part of what we think we're hoping the grants to organizations will help parents understand and to help them know that is a process that they need to follow, that it's a process where they can, submit a grievance to the managed care plan and that they have a right to receive a resolution within 90 days. So I think those are things that I think the parents will become more aware of as these groups begin to provide that information and sort of disseminate that information. It's information that's readily available currently in the enrollee handbook. So if anybody that's a parent, go to the enrollee handbooks for each of the managed care plans. All that information is laid out as to how to submit a grievance and the timeframes for that doing so, as well as appeals and fair hearings. I think there are also a lot of self-help kind of things that a lot of organizations publish. We'll probably be doing something like that as well, to help people navigate this process, because we understand that it's a difficult process. It's a process that's not intuitive, and so we will be creating some documentation to help parents doing some of that. And ultimately, when they're doing those things, and as they're doing those things, that is data that's going to be reported and it will go up in the dashboard. And the district is going to be including in their dashboard the percentage of timely prior authorization decisions by managed care plans. So, that's really important because parents want to know how are the managed care plans doing in terms of, my doctor requests that my child should be getting authorized for speech therapy or occupational therapy. Well, the managed care plans by DC law are supposed to decide within 5 business days at the most, between 3 and 5 business days. And so for the first time, managed care plans are going to be reporting that. They're going to be held accountable and reporting that in the dashboard so that parents can see, oh, wow, this number is really low. It's only, I don't know, 70%, or maybe it's 50%. We don't know because that data hasn't come out yet. And so we are hoping that, that's the kind of information that will be useful to individual parents, but then to advocates like yourselves, right, who can then take that information and go to the DC Council or, present testimony at the DC Council, or to go directly to the managed care plans, to the leadership or the DHCF leadership and tell them, this isn't good enough. We need better. So we think that the key really that we are trying to address, the key point that we're trying to address with the settlement agreement is to provide as much transparency to information as possible so that then other players can hold the district and the managed care plans accountable for their performance. At the same time that we're providing, the expert advisors to help the district to improve its program and have a feedback loop via the MCAC subcommittee group for the district to hear directly from beneficiaries.
Great, thank you. I'm going to pass it to Danny, but before that, I just want to say, I just want to give you your flowers, Zenia. You are a warrior for our families. The road has been rough for my family particularly, and it would have been 150 times rougher without your calm, consistent wisdom and engagement with love and kindness with agencies when I didn't have love and kindness to offer them. So, you are one of our quiet warriors, and I just want to make sure people know just who you've been for our families all this while. So I'll pass it to you, Danny.
Yes, thank you so much for just taking the time to meet with us today and join this podcast. We really appreciate it. Before we close out today, Zenia, Could you share what's one thing you want DC families to know as the district transitions out of decades of court monitoring?
Well, I think I would like for DC families to know that there are lots of people out there in the district, lots of advocates in the district who care very deeply about their issues. There are lots of providers who care deeply about their issues, and that they shouldn't give up. That if somebody says, oh, the managed care plan isn't going to approve X, or they don't, they never approve blah, blah, blah. So that we shouldn't even try for it. That, you as a parent know what's best for your child. Your child has a right to medically necessary services, and those medically necessary services are what is going to help the child maintain or improve a diagnosed condition. And so those are the sort of the key things that parents should remember, that they can and should, they have rights, their children have rights, and that they don't have to take no for an answer. There are processes, there are instruments that they can use, they can file grievances, they can talk to the managed care plans themselves. And there are people within the managed care plans who care about children a lot. And so, but they may not always know at the lower levels what the rules are. And so it's important to escalate your issues. If you hear something that doesn't make sense, or you don't want, there's a, you sort of get a sense that maybe that's not the right thing, escalate those issues. Escalate those issues to supervisors, escalate those issues to district, to leadership in the District of Columbia, escalate those issues to the DC Council. Just, there, and talk amongst yourselves. Parents have learned there are so many parents that have different experiences, but each of them have learned valuable lessons as to how to navigate the process. So one of the most valuable resources that parents have is themselves. So they can, and they're trustworthy. They're 100% trustworthy because there are no incentives there to lie or to at all. So I think if you trust talk to parents, talk to the other organizations in the District of Columbia who also care deeply, Advocates for Justice in Education is one of them, who are there to help parents. And so I would like for parents to know that they're not alone in this, that we are facing really difficult times ahead. The district has lowered the income requirements for example, for caregivers, not for children, but for caregivers. There are a lot of families who are undocumented who may lose some of their benefits. So it is a lot of turmoil happening. The budget, the district's financial situation at the same time is not great at all, to say the least. And so there are going to be times ahead, I think, where the district will be and the managed care plans will be looking to strongly utilize their utilization management. And so what that means is they will be trying to, either reduce or maybe deny. And that's really where we all need to be really, really vigilant of what our children's rights are. Don't accept caps. If somebody says, your child can only have 5 visits, if the doctor says, or the therapist says that your child can benefit from more, then your child has a right to more. Don't accept caps if you have children, if your children, the managed care plan tells you that. And so I think that's really, really important, to not take no for an answer, and to, make sure that you seek resources, talk to people.
Thank you, Zenia. We really appreciate it. I'll pass it back to Emil.
Yeah, well, thank you so much, Zenia. We're extremely grateful just for your presence and for your work. Piggybacking off of what Chioma and Danny were talking about, you are a silent warrior, but your name rings bells. We were talking about having this meeting with our parent ambassadors in our last meeting, and they were talking about how they already knew who you were and about your work. And so we just appreciate, how you get on the ground for everybody. So. Thank you so much just for your presence and for your knowledge. Speaking of our parent ambassadors, for part 2 of this series, we'll be joined by our parent ambassadors to relook over this part 1, process it together, and just kind of reflect on this moment of what it means for caregiving, community organizing, and disability justice. So look forward to part two for that. We'll also be weaving in ideas from the book Care Work, Dreaming Disability and Justice by Leah Lakshmi, and just to help us dream forward and make a plan for 2026 and on. So I just appreciate everybody coming through to this part one, and we're looking for a big push in 2026. We're just spreading the word and making our voices heard as caregivers around the city and hopefully nationally.
Thank you so much. I really appreciate this opportunity and to speak to the community, and always welcome ID 5 visits. If the doctor says or the therapist says that your child can benefit from more, then your child has a right to more. Don't accept caps if you have children. If your children, any the managed care plan tells you that. And so I think that's really, really important. To not take no for an answer, and to make sure that you seek resources, talk to people.
So welcome back to Voices of Health Justice. This is part two of our first episode, and today we are grounding what we learned yesterday in lived experience. During this segment, we heard from attorney Zenia Sanchez-Fuentes about the outcome of the Salazar versus District of Columbia case and its implications for Medicaid accountability, EPSDT enforcement, and families navigating DC's healthcare system. This segment is a little bit different. It's about reflection, care, and truth-telling. We're joined today by members of our AJE Parent Ambassador Program who are parents, caregivers, and advocates whose lives are directly impacted by the systems we're discussing. Your voices are the backbone of the Health Justice Project, and we're honestly just grateful to have you all here and have your presence and your experiences discussed.
So after hearing Zenia's presentation, we want to hear from you all. How are you feeling? We'd love to hear about your experience with the Salazar case, and I'll pass it on to whoever wants to go.
Okay. Well, good evening. I'm a parent of two of the plaintiffs in the Salazar case. Today happens to be one of their birthday. As Michael, as he turned 17, I just can't help but reflect about how far we've come. With, of course, the help of the legal team that was part of this agreement within the Salazar case. Having access to early intervention, early screening was really an effective strategy for getting access to healthcare coverage for my son and my daughter. But I can tell that there's a difference between what it was like when my first child, who's 4 years older, and I were trying to navigate an unfamiliar diagnosis, trying to couple employer-based healthcare with government services. And it wasn't until we heard about the Salazar case and that we became part of the claim, I guess, that we realized how dramatically underinsured we were when we were solely relying on employer-based healthcare to get services for a special needs child. We ran into problems with getting access to screenings. We had ran into trouble with getting early intervention styled pediatric services that were like occupational therapy was difficult. Speech therapy seemed to be quite the way to go at first, but without understanding that the full landscape of services, it was really important that we had the legal team to help us with that. And ultimately, when we came time to try to make purchases of services, being able to get timely and dollar for dollar reimbursement for out-of-pocket expenses, such as the mileage it took to drive cross state lines to get service to service providers, the getting access to occupational therapy, physical therapy, when those specialties were not necessarily had services in the DC city limits proffer, access to transportation and coordination of care in terms of transportation services and coordination of care in terms of scheduling the different appointments. was made so much easier when we knew that we had the services of the legal team available to us, and it was really helpful for in terms of accessing things like getting dental care and dental procedures done in a timely fashion as well. So again, I'm really concerned about the ending of the settlement because I don't necessarily know how newer parents are going to find the resources, find the time in the day to chase resources to get that level of intervention and level of intervention that the attorneys were able to provide.
In like 2 decades is a very long time to be plugging away at equitable health care for children, and especially children with disabilities. I think that they have made some great progress as it relates to accountability, especially for the managed care programs. And the 2 years that they have to become in compliance with um, what the court has ruled, I think it's a long time coming. It's something that it's one of those situations where you think to yourself, how does a superpower like the United States of America even have this as an issue?
Mm.
One of our most vulnerable populations, our children, should be cherished, and there should never be a circumstance where their health, education, or welfare are not a top priority, especially as it relates to any kind of budget oversight hearing or allocation in a budget or um, systems of care that are supposed to protect and keep our children healthy and safe has undergone, uh, has been undercut and underfunded for far too long.
I'm somewhat like optimistic in the sense that I feel like, the way she sort of frames things is pretty consistent with how I, view Medicaid and um the services specifically that are provided in this area.
And thank you for that response. My next question is, and this is maybe a little bit more personal, is what has it been like trying to ensure that providers are providing early and periodic screening, diagnosis, and treatment, or EPSDT for your child or your children or whoever you're caring for?
One of the key things about period early screening is that you have to know what to ask for. You have to be having the knowledge, having some background on your child to even know what to ask for. That part was really difficult in getting screenings that didn't just focus on the symptoms, but actually getting screenings that can involve testing for some of the larger background causes. So, for instance, when I was looking for early intervention services for my daughter, people really focused on the lack of the language difficulty she was having. But it wasn't just language. It was also, wasn't ultimately, she may have had a diagnosis that focused on her language initially, but without early intervention, we would not have gotten the full diagnosis of autism or of autism spectrum disorder without having the full access to diagnostic tools.
Well, for me, it has been smooth sailing. One of the climates, if you will, that I try to create as it relates. So I'll talk about Daniel. Um, Around in the realm of early relational care, whereby each and every clinical worker, mental health worker, provider of speech OT, every teacher, down to the bus operator and bus attendant that transport him every day, are very well aware of his one pager. They know that I do not like working in silos. I create a group email with everyone that has been charged with providing care for Daniel is held accountable. When people know that someone else is watching, they tend to put their best foot forward. And so I make sure that the primary care doctor is on the same page with our neuro doctor or our sleep doctor. And I have found that once these providers, it doesn't matter how many letters are behind their names, once they realize that you are in the driver's seat and that you have taken control and ownership over your child's, whether it's their medication management, their education, their medical treatment plans, once they understand that you are the captain, if you will, of that ship, they tend to make sure that you get the best services possible. Now, I don't have any particular issues or problems because I have put myself in rooms and in positions whereas not only am I respected, but I'm regarded as a parent that um, is truly concerned and is active and involved. But let's think about the masses, the families that um, don't have the knowledge or the understanding of how to navigate systems. Those parents are probably not afforded the quality or the level of care that their children deserve.
Well, in Jennifer's case, I realized she has, HSCSN, which is somewhat connected to Medicaid in a way, but not directly. Um, but I think initially, when we were managing much more from a physical health perspective, as well as more of a developmental health perspective, not knowing, what delays, if any, she would have, and so on and so forth. It was really important at that time to advocate for her from, the very beginning, even though I was at that point her foster mom. So, it made things a bit harder because I always had to get sort of a consent from her birth mom, even though her birth mom didn't really comprehend, what was needed.
Mm.
So that became frustrating. But um, I think we've lucked out in terms of some of the case managers we've had, but we recently lost our case manager to, she went back into like academia. So we're at a point where I have to really um, be more assertive again, or be the advocate that that I've been, but even more so to make sure that we one get a case manager, and two, that case manager sort of comes in with an understanding of sort of the gaps that still remain. And like I know that, for example, there was some speech delay. And I know, when you meet her now, it doesn't seem that way, but it still exists. And HSCSN or specifically children's, when your child has gotten some speech therapy, there's like a gap that they like, there's a 6 month gap in between to see how much they can grow sort of on their own or so on and so forth. And because Jennifer had a updated neurodevelopment screening in September, where the clinician recommended that she go back into speech therapy, a bit earlier than the 6 months or whatever. That's been a little tricky because, I would prefer for her to go back to the speech therapist that she had, but I also don't want her to like be delayed, and, so it's getting those services at the right time and identifying like when she had her updated neurodevelopment screening, some parents said to me, "Oh, it's a miracle that you were able to get her like back in for another updated assessment before she turned 5," because I guess it's very difficult normally to do that. But I just keep pushing, but I feel like I have friends. I don't know if I've mentioned this, but I have several friends. One, like my best friend in Germany, her son is nonverbal or pre-verbal, I guess, at this point. And seeing what she has to sort of navigate in a system where, we think we have it sort of a challenge, but being like in a country or a continent where, special needs aren't really recognized as like something that can be something that can be improved versus like letting the child sort of fall through the cracks or whatever, has given me a more like positive, even more of a positive perspective on what Jennifer has been able to receive. And even my friends here who don't have HSCSN or don't have that same sort of system of services, I can see where like the differences lie as well, where, they're trying to sort of piece together the services that I was it was easier for me to piece together because most of her care is at Children's. I think that's a big difference.
Um, so for the next question, what do you hope changes now with the settlement agreement in place since Halloween? How are you feeling about the consent decree ending? And anybody can hop in.
I can hop in. One of the things that I hope changes, and I know that DC Healthcare Finance does have um, stakeholder involvement. One of the um, accountability measures that was mentioned was that the managed care partners must perform at or above 90%. I am hoping that consumers like myself and my peers here that are parent ambassadors and advocates for justice and education, I hope that we are afforded the opportunity to serve on one of the oversight boards or as a stakeholder in monitoring the managed care systems that are charged with providing services for our families. And I'd also add, in addition to that, I would hope that the crucial medications that our children need to be able to function and focus on a daily basis. I would hope that the prior authorizations and the need to demand that our children use a cheaper or um, another option as opposed to paying for the medication that we know works. I would hope that they would stop trying to find workarounds in paying for the medications, the treatments that our children need.
What I wanted to add is that one of the things that's been really impactful has been expanding the definitions of what would be not alternative modalities of treatment, but modalities of treatment that consider the whole child and consider um, the social and familiar aspects, such as the fact that we were able to get expansions into fitness as a therapeutic outcome. Fitness, physical therapy is uh, not just literal physical therapy, but having the importance of having summertime experiences like therapeutic camps, therapeutic respite. Those are some of the innovations that we were able to do as families advocating within the current the decree, and having advocates like legal advocacy to help interface our requests with then the healthcare system and actually get them honored, even if it was something that we had to do as a reimbursable expense. So if in the past, if parents wanted to investigate taking their kid to a therapeutic setting outside of the medical home, it was something that was thought of as a luxury that you would have to pay out of pocket. Well, I really want to I hope that we can continue to see some guidance and getting some support for parents who to at least get medical reimbursements as a way of streamlining it. And I hope that there's some of the innovative things like using therapeutic camps, using non-traditional peer-centered techniques for therapy, for mental health and other therapeutic models will continue going continue post decree being finalized.
So we're going to move on to our next question. And we wanted to point out that one of the books that we've been reading together is Care Work, Dreaming Disability Justice by Leah Lakshmi. This book reminds us that care work is survival work and also collective liberation work. When you hear the phrase care work, what does that mean to you? And I'll pass it on to whoever would like to go.
When I hear the phrase care work in the disability space, my first thought is a holistic approach to ensuring that all of our families and persons with disabilities needs are met in a very respectful, comprehensive, and pervasive manner. It means that no one takes our autonomy away from us when it comes to making decisions about our care. Oftentimes, clinicians and professionals will assume that because we have a disability, that we're not competent enough to be a part of our own decision-making process. So it means preserving our autonomy. It means providing first-rate care and making sure that it's Medicaid billable. It means allowing us to be co-creators of our own treatment plans. And for example, if a mom with disabilities decides she wants to have a home birth, every measure that is needed to make that a success in every way should be afforded for her. Traditional Western medicine should not be our only alternative when it comes to care.
I'm sorry, guys, I'm off camera, but I would like to say that care work for me is about the journey through the entire lifespan of your young person as they deal with their illness, deal with their disability or chronic disease or chronic illness. We're as I'm celebrating quite a few milestones this week. On first, the 17-year-old birthday of my son, as well as the 21-year-old celebrated her final visit at Children's National. I.e., she at 21, she's been able to transition into the adult disability world and actually has been, we spent almost a full calendar year finding the finding her next set of doctors in the adult world, in the adult disability world. So for me, caregiving is something that's not that it doesn't stop. It's just that it changes as your young person goes through the lifespan, from being early diagnosis, youth, from obtaining treatment in the educational sector, treatment in the medical sector as a young person in school, and then finally transitioning on out into finding equivalent adult care in adult providers. You want to say hi, Michael?
Hey, it's my birthday.
Oh, hold on. So the birthday guy wants to say
Hey, happy birthday, Michael.
Happy birthday, Michael.
There we
Big
go.
17.
Happy birthday, Michael.
And since my birthday, all y'all send me $5.
We gotta send you what? What's the request?
Cash
You
App.
asking
Cash
for
App. Okay.
Michael's asking for money on his birthday. Is on his birthday.
No better than
Is the most he said in 10 years.
That's right. But with braces on.
Ain't heard a word out of Michael. It's my birthday. Send me $5.
Yeah, $75.
I'm going back off off camera and on mute.
Is that anything you want, Mom?
Okay.
So I don't know if Cece had an opportunity to answer the question, but I was just thinking about care work and the journey that I have been on since I have met Chioma and worked with her and Renee. And care work also speaks to the collective and cooperative work and responsibility for each other. It speaks to us providing our expertise for one another in preparation for making sure that all of the accommodations are met for our children, or attending IEP meetings together, or joining one of the amazing co-ops that Chioma created so that we provide services ourselves for our own community. So the concept that we are the persons we've been waiting for is something that I was able to learn about, join, and co-create with Chioma through FixPat, through Neuro Mamas, and just building community with Chioma and Renee gave me a real sense of ownership in care work and not just expecting others to provide services and care for my family, but learning and understanding how I'm responsible for doing that, not only for myself, but for other families in community outside of traditional systems of care.
Yes, cooperation is our future, not just our past. So looking forward to that. I just want to move to the next question, and I want to frame it with the written word. So first, the book talks a lot about the concept of interdependence, not just independence. And so just kind of going off what you just said, Fari, it's also understood as collective care or community care as a core principle of disability justice. Now, how does the concept of interdependence resonate with you? And, based on the reading, but also just authentically what you're feeling about the concept.
Interdependence resonates with me in that I believe there is an unspoken understanding of disability caregivers that we are created to be interdependent. I am my sister's keeper. I know that and it has happened within our circle, the interdependence has shown up without hesitation. If Daniel is sick, or if I am sick, Chioma is going to step in and care for Daniel. If one of us are hospitalized, we'll make sure that all the children are taken care of. If one of us is not very well versed or aware of how to navigate a certain type of IEP meeting, another one of us that has experience in that regard will step in and make sure you're prepared before the meeting and might even attend that meeting with you. Interdependence for us means you do not have to walk any road alone. That we will always support one another. We will always champion each other's causes. We will always be there, be a shoulder to lean on or cry on. And not only in times of despair, in celebratory moments, we will always be there to celebrate your wins, to cheer you on and push you forward as it relates to your professional career. Because oftentimes, caregivers of children with disabilities don't believe that they deserve to have a life outside of caregiving. And our interdependence steps in and tells us to encourage one another to still have your own independence. And so for me, um, interdependence has been the driving force behind my higher education, my my quest and thirst for learning and for knowledge until I got in rooms with other caregivers of children with disabilities and saw how they were thriving, because I was one of those moms who believed that my station was at home and I was to be the best domestic engineer and I didn't deserve my own life or identity outside of caregiving. And once I saw like boss moms, holding down the home and career and doing it all throughout challenges, I realized that I too could pursue things of interest to me outside of caregiving.
Is anything anybody else want to add?
I don't know. I think on some level, I'm still working towards that in a way. Like, I feel like I'm in a place where it is sort of like I don't have the independence that I once had, especially as a single mom to a special need. I think that makes a difference on some level. It's all like the ideal is to have that village, and on some level, in some cases, I do, but I think I'm still building that on the way. I don't know if that makes any sense. I don't think I have the quote unquote community um, that allows me to have those days where I can just go and meet up with friends or have a life at this point. I don't know. Maybe it's an age thing. I don't know what, like the age that Jennifer is at, maybe I don't feel as comfortable. having that independence. I don't know what it is.
So, one of the greatest challenges I've experienced as a disabled caregiver of children with disabilities is respite care. Creating circles of interdependence affords and allows caregivers to establish and maintain close relationships with other caregivers that once they learn their children and how we care for them, are able to step in and provide the respite that sometimes you absolutely need in order to stay sane and or to stabilize yourself. Not only that, interdependence allows us to have accountability partners. Like we have um, relationships that are close enough so that we can hold each other accountable.
I appreciate, both of y'all's perspective on that. I think the fact that we're trying to build community in this space is key, because even going back to what Renee said at the beginning of this podcast, you can really only have so many lawyers, you can only have so many professionals in this. We really do need to kind of be here for each other as caregivers, whether you're a parent, or whoever you're caring for. So I think us here is part of building that community. So I appreciate y'all for sharing. Really a great transition into our third segment. We're just recording this during a moment of major political change. You see these Medicaid shifts, you see all this instability on the federal level, local policy changes that are directly affecting our ability to be caregivers. And so I just want to gauge that. We just want to ask the question to everybody about what feels most urgent to you right now, which is hard because it's a lot going on. But if you could narrow it down to what feels most urgent, what would that be? And on top of that, what gives you the most hope right now? So I'll open the floor up.
Okay. What feels most urgent? My mind is thinking both federally and locally. What feels most urgent federally is making sure that the tax credits under the Affordable Care Act do not end at the end of 2025, and that we have enough members of Congress to have the courage to save the Affordable Care Act. When one of us gets sick, we all get sick. If your health coverage is lacking and it makes you vulnerable, or if you have a pre-existing conditions and it makes you vulnerable, there is more than likely someone in your family that will have to step up and care for you. So it's not a me problem, it's a we problem. Nationally, our country's healthcare system is severely broken, and saving the Affordable Care Act would be a saving grace for families across the nation. I believe locally, we just have to fund Medicaid. um, hundreds of thousands of children in the District of Columbia rely on public health care. And many of those children have pre existing conditions, chronic illnesses, even terminal illnesses. And the thought of those crucial and critical services being interrupted or terminated is daunting, to say the least. I think about our undocumented brothers and sisters that I believe their children are the most vulnerable population in DC at this time. And the thought of those children going without care um, because of racism and oligarchy and authoritarianism sickens me. Those families have a right, not a privilege to health care, but they have a right to health care. The hope that I have is that a humanitarian spiritual wave will will overtake our lawmakers, politicians, and decision makers. They will have a heart. Um, they will love more, and they will lead with love and light, and realize that it's easier to pay on the front end because you will pay either way. Either you will pay up front and take preventive measures to have a comprehensive healthcare system, or you'll pay on the back end when it all falls apart. My hope is that we pay on the front end and do the right thing and take care of our own.
Um, I think Fari said it pretty accurately, but um, I think the start of, not to sound cynical, but I feel like whatever, like when John McCain voted against, what he voted against before he passed away, he sort of saved the Affordable Care Act in a way at that time. And it was just a matter of time, given the sort of non-biased partisan composition of the court, and now that they have the majority of both um, sides of Congress, I feel like, as Fari said, ideally we would have a greater number of Republicans that have guts, but like, even the fact that the one big beautiful bill passed, like I think that was the beginning of the end of, because it's like they just care about their pockets at this point. A lot, a large majority of on both sides, and on some level, I feel like they don't have our best interests at heart anymore. And that's, the main. So how do we, I guess by some miracle, they could vote to extend um those affordable care credit, tax credits. But it just seems as though it's just an unfortunate situation, obviously, and a lot of people are going to get hurt. And um, I also think that a lot of the people that voted for this didn't know what they were voting for, and now we all sort of suffer for it, and that makes me very frustrated and upset. And I never expected that, the downfall of, not to sound alarmist, but I didn't see like the demise of our democracy occurring like in less than a year. Like I feel like it just goes to the fact that a large majority of the population are just very like misinformed, and they're not curious enough to really seek out the truth and the consequences of what their choices.
Yeah, thank you for that, Cece. And it's hard not to see that. Honestly, with the way things have gone even in the last 4 months, ever since October. Um, you know, Political officials and they've been voted in. These aren't really people who have our best interest in mind. It's something that, you know, a lot of citizens have felt for a long time, but now really everybody should feel that way. Um, and I think it's time that we start relying on each other, because it's really all we've got right now. But thank you for that.
Wanted to pivot and ask you all to just say like your final take on all of this to end the podcast.
Bari sort of framed the ideal, like that really resonated with me, where like we could sort of become our own sort of, I don't want to say respite, but like our own like village in a way, you know. But I think we sort of have to like work on, like I think we're working towards that. I don't feel like, I mean, I would trust, obviously, it's a trust, you know, like I'm a very probably, you know, like I'm not a helicopter mom by any stretch, but like I would trust Bari, you know, to hang with Jennifer and Daniel, you know, like I don't like have it, but I just feel like as a group, we have to sort of continue to get to know each other, because I don't feel like I know, you know, everyone else as well as I know like Fari and Renee, you know what I'm saying? Does that make any sense?
Absolutely.
Absolutely. Yeah, it makes sense. I'm thinking what comes to mind with this question is um, having my mom teach me about how the Black Panther movement started what we know today as the free lunch program. They saw a need in the community, and as radical as they were, um, one of the aspects I remember from the care work book was about being strong and vulnerable at the same time. And as radical as the Black Panthers were, they saw this real need within the community, and not just thinking about how to fight the opposition. For our case, it would be how to shape policies and shift narratives within the political arena to the advantage of people with disabilities. But looking inward and saying, what is the immediate need that we have? And how do we shore each other up? How do we make sure that we are taking care of each other as best we can? If nothing came out of this unprecedented presidential campaign, if nothing else came out of it, I have never in the history of America seen people bond together, come together and fight together, stand together, 10 toes down, arm in arm, shoulder to shoulder. Neighbors who otherwise would never have spoken to one another are coming to the aid, coming to each other's aid, and standing and fighting together. We've seen it all across the country with the No Kings rallies. We've seen it all across the globe where people decide to choke the flow of economy until we get results. We've seen it with Target. We're seeing it. We're seeing people step into their power and reclaim their power and actualize, not only realize, but actualizing their power together, um, would be my final words for AJE to continue providing a platform so that disability caregivers can come together and come up with ways that we sustain each other, that we sustain ourselves. Um, what if AJE lost all of its funding and no longer existed? Would this group of parent ambassadors be able to stand alone and figure out ways to continue functioning without the support of AJE? And so that's what I would like to see AJ do. Help us learn and understand and actualize how to be sustainable. And I would like to see our group come up with tangible ways to support each other in ways that we are not supported systemically.
Thank you for that. I just wanted to add on to something that you mentioned far earlier about the free breakfast programs with the Black Panthers, and you talked about how instead of, you know, aside from just fighting the opposition, there was also a form of vulnerability that they had to address with the free breakfast program. But the irony in that is that addressing that vulnerability became the opposition's biggest threat. It wasn't even the guns, it was the free breakfast program, you know? So I think, that's almost poetic, for us to understand what we need in addressing our own needs is actually the biggest threat to what's opposing us instead of opposing them outright. So yeah, I love that you brought that up. Was there anybody else who wanted to some closing remarks?
Just want to say thank you for giving us a chance to give our thoughts on this.
Absolutely, absolutely. Chrysanthemum, is there anything you wanted to say before we closed out?
On that note, no, we have lots of work to do, but I wouldn't want to do it with anybody else apart from our group here. So
Well, to close this out, I want to first of all just thank you all for your honesty, your courage, your leadership. What we heard today, in our first official launching of our Voices of Health Justice podcast is really the heart of our podcast. Caregiving is political, it's justice work, and caregiving is collective. And today we embodied all of that. And so I just appreciate y'all for coming out.